whenever you're working with somebody, an athlete, you have to decide what is the purpose of the current phase that you're working on. And what I mean, hi everyone, welcome to the podcast. For all new listeners, welcome to the family, welcome to the podcast. Those who have heard me in the past, welcome back. I'm excited to do this podcast about strength and conditioning principles integrated into rehab, physical therapy, physiotherapy, everything that you do. Before I go on to the podcast, just a little life updates. I'm actually, for those of you who are watching the video portion on YouTube, I am in the new space. I've been doing most of my podcasts from the new space now just because spending so much time renovating. It is the wee hours of the night on Friday. Most of the podcasts come on Saturday, but it's Friday night and I am exhausted. Just absolutely exhausted. It has been a full day. We started renovations around 9, and I'm filming this podcast around 7. So many hours cleaning, patching to electrical to just getting everything pristine and ready to rock and roll. We actually open in 3 days. And this is the second location for sports performance, and this has been a big vision of mine to do and to see it come into fruition. My team and family have been just working long nights to make this happen, and for any of you guys listening, I appreciate every single one of you. My kids have been part of this, my wife has been part of this, everybody has been part of this, so it's coming together and it's going to happen on Monday, regardless of how ready the facility is. So nonetheless, on to the podcast. So where did I get this idea from? Why are we talking about strength and conditioning and rehab? And I think for most of us, I think we want to do that, but maybe we think of like how or what particular topics do I need to be aware of when I talk about strength and conditioning principles. And for those of you who are listening, I want to make sure that I am talking about the basics, the fundamentals. If you guys want to dive into, periodization, microcycles, and mesocycles, great. I'll do that on another podcast. This one is just generally like how I integrate the fundamentals into rehab. And so this came off of a conversation I had with a team member. They had somebody with hip pain who's a few weeks out from a dance competition, and they've been seeing them for several weeks. And they asked, "What am I missing? What do I need to be aware of?" And I love that question because I have to ask, "What have you been doing? Where's your methodology right now? What are you forecasting? What percent improvement? And what's the next step?" And so they laid it all out, and I thought, "Gosh, they're actually doing really good. They hit all the big things I wanted to address, and they did a good job with that." But the one thing that I had an aha moment with this person was that they were trying to do too many phases of strength and conditioning or phases of rehab at simultaneously within a short time frame, and we had to discuss what phase are they in. And I have to say that for you listening, most of you are either new grads, experienced PTs, or maybe third year, second year PT students, or somebody who's really interested in strength conditioning and wants to work with more athletes. So I want to break this down, and I'm going to break out this case study, and then that way you can kind of put it into context, and then we'll kind of generalize it to most athletes. So this specific client is a dancer, a youth athlete, and pretty high level. They dance, I think, 4 to 6 hours a day, multiple days a week. So it's pretty high level. As I mentioned, they're a youth athlete, and so that kind of gives you context of what their healing phase is and motivation and everything associated with that. Okay, so we have this athlete who has been working with us for about 8 weeks, non-operative, subacute to chronic hip pain, insidious onset, and now they're 85% better after 8 weeks, and they're doing fantastic. They're back to practice. They have a competition in 3 weeks, and so if you look at the outline from start of pain to competition is 11 weeks. So now you have to break out in an ideal world what would you have done to get this person better. If you in an ideal world you can map this out on paper. So I would break this apart with 4 week or 3 week blocks. So 2 to 3 weeks to get this person out of pain, decrease it significantly. 2 to 3 weeks to build up some muscular strength, some endurance, some stability. 3 weeks to get them prepped for returning to dance, and then 1 to 2 weeks of allowing them to go full throttle or integrating back into practice to build tolerance. So this team member asked, okay, so they just finished week 8, they're going on to week 9, and they asked, what am I missing? What should I be doing? And I asked, what are you looking for? Where's your head? Where are you going? Are you thinking about doing strengthening? They're like, yeah, I really need strengthening exercises. What am I missing? And I said, okay, so are they pain relief? Are they fully out of pain? No, they're not. They're 85%. Okay, sounds good. So you're also doing pain relief and focusing on reducing their pain. Yes. But then you're also strengthening them, which can also aggravate them as well. Yes. And you're also getting them back to return to sport and integrating them. So you actually want to increase volume with strengthening, increase volume with return to sport, and work on pain relief. Yes. And as we were talking about it, this person acknowledged, they're like, oh shoot, I can't I can't do all that. It's not possible. And so verbalizing that was very important because they had to realize what aspect am I missing? And just that alone was worth the conversation because they realized I got to choose one, and that's exactly it. So whenever you're working with somebody, an athlete, you have to decide what is the purpose of the current phase that you're working on. And what I mean by that is, I broke down. I'm gathering some notes here that I wrote up for the podcast. So I will, and this is general. This is how I'm going to break out some phases, and this is nothing mind blowing, but it gives you a framework. You have injury prevention. You have pain relief, whether that's acute, subacute, chronic. You have a stability / muscular endurance phase. Maybe you have a general strengthening phase. You have a plyometric / running progression if they're post-op, and then they're actually skill development, returning to sport, and then they're actually in their sport, which is usually driven by their coach on sport-specific skills. So somewhere in there, you have to decide where is the person you're treating. So for this person who is 9 weeks out, they're returning to sport. So they've already been doing plyos and they're returning to sport. And this teamer was asking, well, what should I do for strengthening? Well, you've already missed that block. They should have been, if you had an ideal time frame, you would do this for 6 to 8 months. However, given your timeline, you don't have any more time to develop strength. Truly, maybe you can work on a little stability, but ultimately you're returning to sport. So you're working on managing their pain as they return to sport. You cannot add more strength, which is going to add more volume, more total reps across a week, plus them practicing. It's going to be too much. Whether they're youth or a mature athlete or a 30-year-old, it doesn't matter. It's too much volume. So in the end, you have to decide where is the phase of healing? What is your intent? What is your goal with this phase? And I think that's very rare for people to think like that. I think that for strength and conditioning specialists, maybe personal trainers, whatever you call yourself, this is a good framework they work off of. Now, I will say PT school has really, if you were a strength coach or a personal trainer before you got into PT school, and you had a really good framework of how to manage people and get them to their goals, sometimes I've seen this happen where PT school kind of just turns everything off and focuses so narrow on the pain that you're like, you cannot see things from the greater perspective. And what I mean by that is, I think that people naturally want to think big picture, but because you're a medical provider, you zone into the area of injury. It's very hard to take a step away because that person's right in front of you, unless you planned. And I've had, I think 2 podcasts ago, I talk about planning and organization. Plan A, B, and C is what I call it. So risk mitigation. So unless you plan, you're not really thinking about what you can be doing at a greater scale. Most of the time you're just like, how do I manage the pain? Is there's tissue irritation? You're so zoned in on what you need to do for this person right there and then. And my argument is that you need to take a step back and which phase are they in? Are they in injury prevention? For most of us, that's the dream. I have team members who come up to me and they're like, "Hey, Chris, they don't. This client doesn't have any pain," and I'm like, "What's the problem?" And they're like, "What do I do with him?" Well, if you had a dream client, a dream athlete, and you can build out a whole year, what would you do with him? They're like, well, I'd work on general preparation phase, I get them strong, work on their endurance or stability, work on an injury progression, help, transition them back to sport. I'm like, so what's the problem? They're like, I didn't think about it like that. When somebody comes to you with no pain, I mean, that's like the dream as a medical provider. You're like, perfect. Now I can actually keep you like that. It's everything we advocate for, but we don't know how to manage. We don't see that because we're so zoned in on what wait a minute, you don't have pain? Wait, that's odd. So, injury prevention, it's the dream, yet when it hits us, we're not ready for it all the time. Pain relief, this is where we thrive, right? It's like you have pain, I'm going to try every technique, I can do it, I can, let me just have a comparable sign, I try this, I try that, and this is where you're the magician. This is where your bread and butter is. So injury prevention, pain relief, stability and endurance, great. I think we can all create exercises and do no problem with that. So I think we're great at pain relief. I think we're great at stability and endurance. Strengthening, this is where I think the skill set transitioning into strength and conditioning coaches really takes, like, this is where the separation happens. So I think that we generally like know the strength principles and how many reps or developing power or strength or absolute strength or whatever you want to call it. So I think that we have some awareness, but the thing is like after you do 8 to 10 reps of 3 to 5 exercises, you're like, well, that's kind of strengthening. Well, no, building out a whole week, then building out a whole month, and actually building out a whole quarter with rest periods, and after 3 or 4 weeks taking a rest time or decreasing intensity or understanding what the fit principles are. And so if you're doing all of this takes time. There's you're like a magician. You're just kind of like, you're like a chef. You're putting all the pieces together at different stages. So you've got injury prevention, you got pain relief, you got stability and endurance, you got strength, and then plyos. I think plyos, for most of us, I think that's not too hard. But programming the number of reps, I think we are great at exercise creation. I think at parameters and designing those parameters, that's where we're not the strongest because we're just not there as often. And I think we want to be there. And return to sport, I think based on your setting, I think return to sport is tough. I think that in an ideal world you would have them for 9 to 12 months, but I think insurance or people naturally kind of wean off after they're pain free and they're doing great, and I think that's where they think they're going to do fine by themselves, and then it's harder to keep them on the schedule because the value in return to sport is they feel like they can do it on their own, and I respect that. And in terms of a strength component of what PTs are able to provide, I think return to sport is in the wheelhouse. I think it really is. It depends on your exposure and how often you're seeing these type of athletes. And then the last one is sport specific skills. This is very, very unique. This is like the one percenters of the one percenters of the one percenters. Rarely are we in professional sports or we're working with coaches directly at a high level to work on sport specific skills. So if you ask me, okay, so how do you integrate this all into rehab? I think that first of all, you have to know the phases. And I think where we do great as a profession is pain relief, stability, endurance, plyometrics, return to sport. And where we're not the strongest is true strengthening, like developing 6 to 8 to 12 weeks of strengthening, hypertrophy, strength, whatever you're working on. I think that's where we are not the strongest, and I think sport-specific skills, that's really pretty much like a coaching technique. And then last but not least, and this is, gosh, this hurts, injury prevention. I think it makes sense to most people, but I think that they're not ready for it when somebody literally walks in, they're like pain-free, they're like, oh, great, discharge, and you're like, wait a minute, I could have done injury prevention. I don't think we naturally gravitate towards that. So if you're asking me, Chris, I have this athlete who's in this injury sense or time point. This is their history. I'm going straight to Well, what are you working on? What phase are you working on? Well, I'm working on pain relief. I'm developing their strength. I'm developing, plyometrics and getting them all back to sport. No, no, no. You can't do it all together. Not possible. Not possible. It's very difficult because your volume and intensity are going to change as you return to sport. With the strength and stability endurance, your volume might be higher. As you go into plyometrics, your volume drops. As you go to return to sport, your volume drops. Your intensity starts to increase. So you have this inverse relationship. And I think that, when you talk about injury prevention, you might be on the higher volume of reps as well. So I think that intuitively we want to do this, but what you have to do is compartmentalize. And so right now you're listening to this podcast and you're like, okay, you're thinking about a certain patient or an athlete or client or whatever you call them, and you're like, I do have trouble managing them. It's because you're throwing the whole kitchen sink at them. You're not thinking of, well, how many reps should I be doing? What's the intensity? What's the current phase? Are they going back to sport? So do I need to drop the number of reps and just work on plyometrics, just on return to sport testing? That's great. That's what they need at that time. That's exactly what they need. Now, if you're talking about injury prevention, developing stability and endurance, you can go higher volume, drop your intensity. You don't need that because that's a specific time point that they're probably not practicing. They're not doing a high volume of repetitions. They're literally off season. And that's the way to see that. For most people, you consider injury prevention, pain relief, stability, endurance development, and strength development in the off season. And now when you go in season, you're not really doing, you know, uh, a lot of muscular endurance. You've already developed that. That's what your intention was. Now you're in season, you might be just doing a little bit of plyometrics. You're getting them back to return to sports, sport specific skills. In the background, you're maintaining basic strength. You're not developing it. Most people lose muscle mass and lose size, lose strength in season. That's just a natural component of working on a sport. That's just the nature of it. So if you have somebody in season and they get injured, this is where it gets very, very tough to manage all of these progressions, getting them back because you don't have a lot of time. You're not really working on injury prevention while they're hurt. That's not possible because they're hurt. So you're working on pain relief. You have a few days to work on pain relief, develop a little bit of strength and endurance, get them as strong as possible, and get them back to the sport within a week or 2 weeks or 3 weeks. And so when you're in season, that's a different beast. That's a different progression. Now, if you're managing somebody off season, this is where we do great. But the challenge becomes if somebody is in season and they get hurt. So going back to the example, we had this dancer who's 9 weeks out from competition. They were actually in season at the time, and they had to take a break because of so much pain. So they're 9 weeks, and the team member says, what strengthening exercises am I missing? What should I be adding? And the conversation went about that it's really not about strengthening at that point. You're already too far on. The first 3 to 4 weeks were pain relief. The next 3 to 4 were strengthening, muscular endurance, stability. Now you're out of that phase. Now you're actually returned to sport. So drop the strength exercises. The focus needs to be on managing their pain, any form of return to sport progressions, working with their coach to get them back in, and then dropping the number of reps so that sport is their priority. Rehab is not their priority. They're not a professional rehabber. They are a professional athlete. And because of that, you're here to supplement getting them back in the sport, not focusing on how many total reps or rehab exercises that you actually need to focus on. It's about them as an athlete. So help manage them not by looking at what rehab exercises were perfect, is what phase are they in to get them safely back to sport. I think that in that sense, most of us are pretty selfish. We just think about like, well, how am I gonna use my principles that I currently know to get them back to sport? When in reality, all you have to do is they're an athlete and they want to get to sport as quickly as possible. And you're trying to do as little as a rehab specialist to try and get them in season, strong, build their endurance. You can't. There's not enough time. What you're trying to do is maintain their strength and get them back to sport. You're almost just putting a band-aid. And this is the nature of professional sports. In season, all the damage is done. Where you can make the most gain is off season, preseason. That's where you're doing everything. If you're in season, it's already too late. They've already lost body mass, they've lost strength, and you're just trying to preserve and get them back in. And as a rehab specialist, we don't think like that naturally. And this is why I want to do this podcast. If you've heard this content before, great. Just reaffirming everything that you know. If this is the first time hearing that, you're like, wait a minute, it's getting the wheels spinning. That's what this podcast is for. Now you actually are thinking about where are they relative to their in-season or off-season mode. How do I fit along the spectrum to help them? That's the purpose of this podcast. If you've worked with high-level athletes and you treated them like they were off-season while they were in season, guess what? You probably overworked them. They're exhausted. Central nervous system is fried, and you actually contributed to probably re-injuring them. And I think because we're rehab specialists, we always want to increase volume, throw great exercises in season just doesn't make sense. All you're trying to do is get them back on the field, maintain what they have. And then off season, that's when you're working on injury prevention, that's when you work on strengthening, the endurance, all aspects of that. Now, there's a lot of nuances. If you work with strength and conditioning coaches, great, that's perfect. But for those who want to manage people across a year and manage athletes who maybe don't have the resources for a personal trainer or strength and conditioning specialist, and they need help, this is where you can help across a year. And if you can explain that to a coach, a parent, an athlete who's like, hey, I've been having recurring ankle sprains. Sounds good. This is in season. You're only going to get so far, and I think I can help you. However, if you're looking to manage this long term, I think postseason is where we're going to make the most gains. So I'll get you through this, get you through the sport, maintain whatever you have. After sport, I want you coming back for injury prevention, because that is where we're actually going to develop the true athlete in you, gaining strength, getting you stable, getting you strong, developing the endurance, better balance, reduce the risk of injury so it doesn't happen again. That's where I can help you the best. And that's where you're integrating truly what strength and conditioning coaches and specialists can do for athletes. You're just doing it at a very basic level. And I did a podcast on, do you need a strength conditioning certification? Is it CSCS? And you can listen to that podcast for those type of details. But ultimately, I think all you're trying to do is having fundamental concepts and integrating them into kind of your menu as a chef. You're just kind of throwing in things when certain athletes come at you, and you need to ask before the injury, like before you zone in on the region of injury. What you need to do is ask, where are they along the spectrum of in-season, off-season, preseason? How close to competition are they? And within that, what phase am I healing? What phase am I working on right now, given the circumstances? Don't go straight to your 3 sets of 10 to 12 repetitions, rotator cuff exercises, because that's not the purpose. If they're 4 days out from a competition, you have very little wiggle room, and you're just managing pain. Maintain whatever you can. Don't contribute to the injury. Reduce the volume, and just keep them alive. Keep them, head above water, to make sure that they're safe to return to sport. That is your job. So, how do you integrate strength and conditioning principles? You have to see where this athlete is across their season, what's the competition timeline, and then insert from there, how am I going to manage this person with 3 to 4 weeks out? Which phases am I going to work on? And within those phases, where am I managing the most? Because it might be the technical coach or the strength coach or whatever it is. You're just a portion of that equation. And I think for a lot of us, when we get somebody back to sport, we're like, I did that. I did it all. No, there were so many people behind that. The athletic trainer on the field, the strength coach who built the program leading up to the injury, the technical coach who was working with you to see what they can do. There were so many people involved in that. And I think that that's where you have to take a step back and say, where is the team? Who am I working with? What phase are we in? What's the timeline? And what do I need to integrate? That's how you integrate strength and conditioning principles into rehab. It's not about the reps, it's not the parameters, it's not just about the fit principle, it's understanding what stage are people in and where you're going to contribute the most along their return to sport. So there you have it. It's something I'm passionate about, and I've learned. Where did I learn this? I learned from working in pro sports, working with strength conditioning coaches, working with technical coaches, track and field, working with other physios, working with other chiropractors and massage therapists, acupuncturists who already practice like this, and they changed my view of how to manage a person, how to manage an athlete, and that's what it really comes down to. We're not trying to be the best physical therapist. You're trying to be the best healthcare provider that you possibly can be. And what that does is it requires you to manage people at different phases of healing and acknowledging that, wow, they're not even in pain. What do I do? Injury prevention. What do I need to do? Injury prevention. How many weeks do I have? When is there in season? Who's going to take over strength conditioning? If it's another strength coach, great. How do you integrate with them? How do you work with them? If they're working with nutritionists, when would be the best person? In season? Like, that's really hard. Everything is done in the off season, leading into preseason. If they're in season and they're injured, that's a different ball game. You're working and fine tuning the small details. So, if you want to learn more about the strength and conditioning and how to integrate it, let me know. I can do a specific podcast. I just want to make sure that I'm helping people at the right stage. For a lot of you, because you're either PT students, new grads, experience, you may be integrating some of these principles. Now you're just adding to that, and that's what's the biggest piece of this podcast, is just complementing your current skills and just adding more to your framework. I'm not adding specific exercises. I'm adding just the thought process of how you manage people at the highest level. That's what you do. You're not an injury specialist. You are a people supporter, a manager, a leader. That's what you do. That's literally what you do. And that's why people keep coming back to you, because they're like, what's next? Where can you help me next? And that is the dream as a healthcare provider, as a sports specialist. That's the vision. That's my vision, anyways. And that's where I'm trying to help you guys get to that level. So, all right, it has been a long day, long day. I'm so excited to. We have an event tomorrow, and then we'll open up in a couple days. So I'm excited for that. For those of you who come into the soft opening, I welcome you. If I've never met you and you want to come to the soft opening, let me know. Send me an email, drchris@drchrisgarcia.com. Let me know that you've heard it on the podcast. I love to see our growth. For those who don't know, our podcast has grown to numerous countries. I think there's like 18 states that are like listening to this regularly. So I think Washington, we've got people in California, we've got people in Ohio, Florida, Texas, Kansas, you name it. We have a lot of listeners, and I'm excited to just share more content with you guys. But thank you guys for supporting, and if you're open to come to the soft opening on Saturday, November 20th, I'd love to have you. I love to party and welcome San Diego to our community of physical therapy and healthcare providers, to be able to help them with content like we just reviewed on managing them through their actual seasons, and being able to help support them to just live the life that they want and staying healthy and active. So there you have it. I'm off to be with my family and prep for the weekend, and I will see you guys on the next episode. Take care, guys.